So, if you're looking after somebody with dementia and struggling with accidents, this video will help you understand what's really going on. So please stick with me till the end because I've got some good tips for you. So, incontinence means leaking pee or poo without meaning to. It can be urine, it can be poo, or both. And when both are affected, it's called double incontinence. Urinary incontinence can look like small occasional leaks, or pee continuing to dribble after going, or a total loss of bladder control. And there are different types. And one common type in dementia is called an overactive bladder. And this is a sudden urgent need to pee often. For women, stress incontinence is also common. These are leaks that happen when coughing or laughing or sneezing, usually related to childbirth or aging. And then you have fecal incontinence, which ranges from a small leak when passing gas to full loss of bowel control. It's less common than urinary incontinence, but it affects men and women equally. So there are many reasons someone might become incontinent, and the risk increases with age and with dementia. But other medical conditions can also play a role, some of which are treatable. So I've got a few here that are common causes in older people. These are urinary tract infections, or UTIs as they are commonly known. And these can cause sudden urges or burning while peeing, or fever plus incontinence. Then constipation puts pressure on the bladder and can cause leaks. And in severe cases, a hard stool gets stuck and the soft stool leaks around it and can be confused with diarrhea. Then prostate problems in men. These can also lead to bowel issues. Medication side effects. Some medication can cause bladder or bowel changes. Other bowel conditions like irritable bowel syndrome, which is IBS. So these are all issues that doctors see regularly, and they are often treatable. But many people feel embarrassed and they don't seek help. So dementia increases the chances of incontinence, not just because of physical changes, but because of how the brain works. So here's how dementia can affect someone's brain or ability to use the toilet. The brain and bladder don't communicate properly anymore. The person might not feel the urge or recognize the need to go. They may not react fast enough to the sensation of needing to go. Mobility issues might mean they can't get to the toilet on time. They may struggle to speak and cannot ask for help to go to the toilet. They may not understand prompts from carers. This is dementia. Sometimes they can't find or recognize the toilet, and they may mistake a bin or a corner for the loo. They might forget how to use the toilet, like, how to remove clothing. They may refuse help out of confusion or embarrassment. And sometimes they just don't try. They may be depressed, they may be distracted, or they simply forget. So what happens after an accident? Shame, fear. And some people try to hide their soiled clothes or wet items in drawers or wardrobes, then forget they're there. They forget. If the carer doesn't look for them, you can only tell when the smell comes out. So this isn't just a physical issue, it's emotional too. So why does this matter? Incontinence is often seen as a taboo topic, especially in dementia care, but it's incredibly common and support is available. It's available, it's there. So ignoring it only leads to distress, infection, skin problems, and loss of dignity. Talking about it means you get better care, you get better understanding, and better lives for people living with dementia. So Our GPs and our continence nurses and our carers are trained to support this, and families need to feel confident asking for help. So, in closing, incontinence in dementia isn't about poor hygiene or laziness. It's about how the brain changes and how we respond. Let's remove the shame, ask the right questions, and give the support people need. If you found this helpful, share it with someone who's caring for a loved one with dementia. And remember, compassion starts with understanding. Be kind.